You're watching Firecrackers, and we are live here in Lagos, Nigeria. We have guests here in the studio. You'll get to hear from them in just a moment. But let's cross over live to the United Kingdom, where we have Dr. Etiowo Ekanem standing by to speak with us, consultant family physician from the UK. Doctor, thank you most kindly for agreeing to speak with Galaxy TV. Let's begin with the front lines. How are the front lines today?
Front line, I can say that definitely in the UK the rates have fallen significantly when we compare with the peak period between March and May, June. So currently we're probably seeing about, as of yesterday, 758 daily positive cases that were detected. And to put this in context, we would remember we were having about 5,000 positive cases or more during the peak period.
Well, Dr. Ekanem, we are having some very serious issues really hearing you, but if you can hear me loud and clear again, you caught COVID, and thank you for agreeing to share your story with us. We'll get to hear that story because we have a very pathetic situation in Nigeria here, where a good number of Nigerians do not even believe that the virus does exist. But let's talk about the virus for a moment. What new are we learning about the virus?
Well, I think one thing is pretty obvious. The virus is here to stay for some time. And one of the things we're learning is it does manifest in different ways. So some of the initial symptoms we had in mind, of course, like the fever, the cough, have now been expanded to include things like loss of taste, loss of smell, diarrhea, vomiting, abdominal pain, amongst other things.
Okay, doctor, just bring us up to speed with the events around the UK. I mean, what exactly is going on with the UK?
Well, things are a lot better in terms of numbers in the UK. We've had to adapt how we manage patients in the context of COVID. So in the primary care setting, for instance, and indeed the hospitals as well, we have resorted more to remote consultations, so telephone consultations, video consultations, and these are things that perhaps have taken a lot more time to get approval for use. But at the moment, because of COVID, we've had to adopt these measures to maximize patient care under the current circumstances. One of the things the government has successfully done is to increase the testing capacity. So at the moment, you could possibly look at the figure of about 338,000 tests per day across the entire country. Of course, the actual tests are done. As at Saturday, we're looking at 165,000 tests that were done.
Dr. Ekanem, let's get to hear that story. You caught COVID, you have recovered, and we thank God that you're up and well. But share with us your experience. I mean, during when you caught COVID.
I think when COVID was initially in the limelight, a lot of it was mentioned that it was like a mild flu and things of that sort. And I personally thought of things like the SARS episode had in the mid to late 2000s. However, this was a totally different beast, really, and we didn't know too much about it. And for me, my experience was the symptoms came on fairly quickly, and I think I got back from work at the end of the day, and within 3 to 4 hours, I was shivering, lots of muscle aches and pain, and a rising temperature. And I think the closest thing I've had to COVID would be malaria. It felt like malaria times 10 or times 100, to be honest. So really had awful headaches as well. And this was quite an early phase. And the cough and the cold didn't come until about day 3 or 4. And I started concerned. It was really difficult to bring my temperature down despite regular clockwork use of paracetamol at the time. By the middle of day 5, day 6, I started having respiratory symptoms in the form of cough, some difficulty breathing as well. Yes.
Dr. Ekanem, if you can hear me, there are a number of questions to actually ask, but I think that's a good place to leave it. We'd like to thank you most kindly for agreeing to speak with Galaxy TV and then, share your story, your COVID-19 experience with us. Many thanks indeed for speaking with us.
Thank you.
We have been speaking with a consultant family physician in the United Kingdom, Dr. Etiowo Ekanem. We'll just go for a break. We'll be back in just a moment. Stay with us.